Hey there, future nurses. Welcome back to part 6 of our series, where we're diving deep into the 4,500 most commonly repeated NCLEX questions. If you're prepping for the NCLEX, you're in the right place because in this series, we break down the questions that have been showing up over and over again on the NCLEX for the last 5 years. These are the real must-know questions shared by students who've passed the exam and are now RNs. Let's go! This drug-related question has been asked 5 times in the last 5 years.
A patient presents to the emergency department with complaints of numbness in the lips and hands, accompanied by muscle spasms in the hands and feet. The patient's laboratory results reveal low serum calcium levels, and the ECG shows a prolonged QT interval. What condition should the nurse consider as a potential diagnosis?
A. Myxedema. B. Thyrotoxicosis. C. Idiopathic hypoparathyroidism. D. Primary hyperparathyroidism. Correct answer, C. Idiopathic hypoparathyroidism. Option C is correct because this condition leads to low serum calcium levels due to insufficient parathyroid hormone, PTH, production, resulting in the neuromuscular symptoms and prolonged QT interval observed in this patient. Option A is incorrect because it is associated with severe hypothyroidism, which presents with symptoms like cold intolerance, bradycardia, and fatigue, not the neuromuscular irritability seen in this patient. Option B is incorrect because although it involves increased metabolic processes, it does not typically present with hypocalcemia or the neuromuscular symptoms described. Option D is incorrect because it usually causes hypercalcemia, not hypocalcemia, and does not match the patient's symptoms. Let's move on to the next important question. This measles-related question has been asked 4 times in the last 5 years. During a health education session on measles, which critical information should the nurse emphasize to participants? A. Individuals should wait until after international travel to receive the measles vaccine. B. Infants below 12 months old should not be vaccinated for measles before traveling abroad. C. Most measles infections in the United States are linked to individuals who were not vaccinated and acquired the virus during international travel. D. Vaccination against measles is unnecessary unless a person is certain they will encounter the virus while abroad. Correct answer, C. Most measles infections in the United States are linked to individuals who were not vaccinated and acquired the virus during international travel. Option C is correct because it highlights the importance of vaccination prior to international travel to prevent measles outbreaks. Option A is incorrect because vaccination should be done before travel to ensure immunity during the trip. Option B is incorrect because infants between 6 to 11 months old should receive an early dose of the measles vaccine if they are traveling internationally. Option D is incorrect because the measles virus is highly contagious, and vaccination is recommended for all travelers to prevent infection. Now let's transition to the next question, which is just as significant. This infection-related question has been asked 3 times in the last 5 years. A nurse is tasked with providing care for a patient diagnosed with mastitis. Which of the following medications is the nurse most likely to administer? A. Pimecrolimus. B. Ketoconazole. C. Valacyclovir. D. Ceftriaxone. Correct answer, D. Ceftriaxone. Option D is correct because it is an antibiotic effective against the bacteria commonly responsible for mastitis, such as Staphylococcus aureus and E. coli. Option A is incorrect because it is an immunomodulator used to treat eczema, not bacterial infections like mastitis. Option B is incorrect because it is an antifungal medication, and mastitis is usually caused by bacterial infections, not fungal. Option C is incorrect because it is an antiviral medication used to treat herpes infections, which is not relevant for bacterial mastitis. Let's proceed to the next critical question. This mental health-related question has been asked 4 times in the last 5 years. During an assessment, a client expresses a belief that their spouse and a close relative are conspiring to cause them harm. How should the nurse interpret this statement? A. Delusion of infidelity. B. Delusion of persecution. C. Delusion of external control. D. Delusion of grandeur. Correct answer. B. Delusion of persecution. Option B is correct because it involves the belief that one is being targeted or harassed by others, fitting the client's belief of a conspiracy against them. Option A is incorrect because this refers to a false belief that one's partner is unfaithful, which does not align with the client's fear of harm. Option C is incorrect because this involves the belief that one's thoughts or actions are controlled by outside forces, not reflected in this client's concern. Option D is incorrect because it involves an exaggerated sense of one's importance, which is not consistent with the client's expressed fears. Let's move to the next question, which has also been frequently asked. This cardiovascular-related question has been asked 5 times in the last 5 years. A nurse is administering Bumetanide to a patient. Which clinical indicators should the nurse monitor to confirm the medication's effectiveness? A. Elevated afterload. B. Increased jugular venous pressure. C. Reduction in left ventricular end diastolic pressure. D. Decreased renal perfusion. Correct answer. C. Reduction in left ventricular end diastolic pressure. Option C is correct because bumetanide effectively decreases blood volume, lowering preload and reducing left ventricular end diastolic pressure, which is beneficial in conditions like heart failure. Option A is incorrect because bumetanide, a diuretic, is intended to reduce, not increase, afterload by decreasing blood volume. Option B is incorrect because this would suggest fluid overload, the opposite of the desired effect of bumetanide. Option D is incorrect because it would indicate an adverse effect rather than therapeutic success. Let's transition to the next crucial question. This cystic fibrosis-related question has been asked 3 times in the last 5 years. When assessing a child with cystic fibrosis in an outpatient setting, which laboratory tests do the nurse expect the healthcare provider to prioritize? A. Lipid profile. B. Serum electrolytes. C. 24-hour creatinine clearance. D. Random blood glucose test. Correct answer. D. Random blood glucose test. Option D is correct because it is essential to monitor for cystic fibrosis-related diabetes, a common complication in these patients. Option A is incorrect because it is not a priority test in the routine assessment of cystic fibrosis-related complications. Option B is incorrect because, while important, it is less critical than monitoring for cystic fibrosis-related diabetes. Option C is incorrect because it assesses kidney function, but is not a routine priority in cystic fibrosis monitoring. Now let's move to the next key question. This eye injury-related question has been asked 4 times in the last 5 years. A patient with hyphema is being cared for by the nurse. What is the most important initial intervention the nurse should implement? A. Administer anticoagulants as prescribed. B. Apply an eye patch to the injured eye. C. Position the patient flat on their back. D. Use cold therapy on the eye. Correct answer, B. Apply an eye patch to the injured eye. Option B is correct because it protects the eye from further trauma and helps reduce intraocular pressure, crucial in preventing complications. Option A is incorrect because anticoagulants could worsen bleeding and are generally contraindicated in hyphema. Option C is incorrect because this can increase intraocular pressure, worsening the condition. Option D is incorrect because cold therapy could also increase intraocular pressure and is not recommended for hyphema. Let's move forward to the next important question. This pediatric-related question has been asked 4 times in the last 5 years. The nurse is evaluating a pediatric patient presenting with a sore throat and inflamed tonsils covered in white patches. What diagnostic test is the primary healthcare provider most likely to order? A. Sputum analysis. B. Throat swab culture. C. Comprehensive viral respiratory panel. D. Complete blood count. Correct answer, B. Throat swab culture. Option B is correct because it is the standard test to diagnose bacterial infections like streptococcal pharyngitis, suggested by the white patches on the tonsils. Option A is incorrect because it is used for lower respiratory tract infections, not throat. Infections. Option C is incorrect because it is less likely to be the initial choice for diagnosing bacterial tonsillitis. Option D is incorrect because while it can indicate infection, it does not provide the specific diagnosis needed to guide treatment. This burn-related question has been asked times in the last 5 years. It's a critical question that has appeared multiple times and could very well show up again in the exam. A client has sustained deep thermal injuries covering the entire anterior and posterior thoracic regions. What is the nurse's top priority action? A. Insert a Foley catheter to monitor urine output. B. Obtain an accurate body weight for fluid calculations. C. Evaluate the client's airway and breathing. D. Initiate a fluid replacement protocol with lactated ringers. The correct answer is C. Evaluate the client's airway and breathing. C is correct because assessing the client's airway and breathing is the top priority in cases of severe burns, especially those involving a large surface area. The risk of inhalation injury, respiratory compromise, and carbon monoxide poisoning is significant. Ensuring the client's airway is clear and that they are breathing effectively is critical to prevent life-threatening respiratory distress or failure. A is incorrect because, although important for monitoring urine output and fluid resuscitation effectiveness, it does not address the immediate critical threat, which is the client's respiratory status. B is incorrect because obtaining the client's weight, although necessary for fluid calculations, is not as urgent as securing the client's airway and breathing. D is incorrect because while fluid resuscitation is vital to maintain circulatory volume in burn patients, it is not the first action. Fluid replacement becomes a priority after ensuring the airway is patent. This drug-related question has been asked 5 times in the last 5 years. Pay close attention, as this type of question often reappears in exams. The nurse is about to administer digoxin to an infant patient. Before giving the medication, what is the minimum apical pulse rate the nurse should verify? A. 50 beats per minute. B. 70 beats per minute. C. 90 beats per minute. D. 60 beats per minute. The correct answer is C. 90 beats per minute. C is correct because the appropriate minimum apical pulse rate before administering digoxin to an infant is 90 beats per minute. Digoxin has a strong negative chronotropic effect, lowering the heart rate. Administering digoxin when the heart rate is below 90 bpm could lead to bradycardia and heart block, making it critical to verify the pulse rate before administration. A is incorrect because an apical pulse of 50 bpm is dangerously low, and administering digoxin at this rate could result in significant harm, including severe bradycardia or heart block. B is incorrect because an apical pulse of 70 BPM is too low for an infant receiving digoxin, increasing the risk of severe bradycardia. D is incorrect because a heart rate of 60 BPM is also too low for safe administration of digoxin in an infant. This MAOI-related question has been asked 8 times in the last 5 years. Understanding this concept is key, as it has shown up repeatedly. A client on a monoamine oxidase inhibitor, MAOI, is receiving education from the nurse. What vital sign should the client be most vigilant in monitoring? A. Blood glucose. B. Heart rate. C. Blood pressure. D. Daily weight. The correct answer is C. Blood pressure. C is correct because blood pressure monitoring is crucial for clients taking MAOIs due to the risk of hypertensive crises and orthostatic hypotension. MAOIs can interact with certain foods and medications, potentially leading to dangerously high blood pressure. Conversely, they can cause significant drops in blood pressure, leading to dizziness and falls. Regular monitoring of blood pressure allows for early detection of adverse effects and timely intervention. A is incorrect because monitoring blood glucose is not typically required with MAOI therapy unless the client has an existing condition like diabetes. B is incorrect because while generally important, it is not the primary concern for clients on MAOIs. Blood pressure is more likely to be affected by these medications. D is incorrect because, although weight monitoring might be necessary if the client is on other medications, it is not a primary concern with MAOI therapy. The focus should be on blood pressure management. This PTSD-related question has been asked 6 times in the last 5 years. This question is highly relevant and could appear again, given its frequency. During an evaluation of a client with post-traumatic stress disorder, PTSD, what symptom would the nurse expect to find? A. Rapid, disconnected thoughts. B. Overly detailed speech. C. Grandiose delusions. D. Hyper-alertness. The correct answer is D. Hyper-alertness. D is correct because hyper-alertness or hypervigilance is a common symptom of PTSD. Clients with PTSD are often in a state of increased arousal, constantly scanning their environment for potential threats. This heightened state of awareness can lead to an exaggerated startle response, difficulty concentrating, and sleep disturbances, which are hallmark symptoms of PTSD. A is incorrect because rapid, disconnected thoughts are indicative of mania, particularly in bipolar disorder, and are not a feature of PTSD. B is incorrect because overly detailed speech is more associated with conditions involving disorganized thought processes, such as schizophrenia or mania, and not typical of PTSD. C is incorrect because grandiose delusions are more characteristic of disorders, like bipolar disorder during manic episodes rather than PTSD. This anaphylaxis-related question has been asked 9 times in the last 5 years. Given its high frequency, mastering this question is essential. When educating staff about anaphylaxis management, which information should the nurse prioritize? A. Position the client in reverse Trendelenburg if shock develops. B. Ensure the client has an epinephrine autoinjector available at all times. C. Initiate an infusion of normal saline after securing IV access. D. Administer intravenous diphenhydramine as the first-line treatment. The correct answer is C. Initiate an infusion of normal saline after securing IV access. C is correct because establishing IV access and beginning an infusion of normal saline is critical in managing anaphylaxis. Anaphylaxis causes a sudden drop in vascular tone, leading to severe hypotension. Isotonic fluids like normal saline are administered to restore circulatory volume, making this step crucial after ensuring the airway is protected and epinephrine has been administered. A is incorrect because, in shock, positioning with legs elevated, Trendelenburg position, is more appropriate to enhance blood flow to vital organs. Reverse Trendelenburg is not recommended. B is incorrect because while important, the priority in acute management is to restore circulatory volume after airway protection. D is incorrect because the initial drug of choice is intramuscular epinephrine, which acts quickly to counteract anaphylaxis, including airway constriction and hypotension. This withdrawal-related question has been asked 10 times in the last 5 years. It's another critical question that has been a consistent feature on exams. A client presents to the emergency department with signs of delirium tremens. What is the nurse's immediate priority? A. Request a prescription for chlordiazepoxide. B. Assess the client's consciousness using the Glasgow Coma Scale, GCS. C. Evaluate the client's pain level. D. Initiate seizure precautions immediately. The correct answer is D. Initiate seizure precautions immediately. D is correct because the immediate priority in managing delirium tremens, a severe form of alcohol withdrawal, is to implement seizure precautions. Delirium tremens can lead to life-threatening seizures, and the nurse must ensure the client's environment is safe with padded side rails, suction equipment, and oxygen readily available. A is incorrect because, although chlordiazepoxide is essential for treating delirium tremens, seizure precautions should be established first to ensure safety. B is incorrect because the Glasgow Coma Scale is not the primary assessment tool for managing delirium tremens. The Clinical Institute Withdrawal Assessment for Alcohol, CIWA-AR, scale is more relevant for assessing the severity of alcohol withdrawal symptoms. C is incorrect because, while important, pain assessment is not the priority in managing delirium tremens, where the risk of seizure and other complications takes precedence. This kidney-related question has been asked 7 times in the last 5 years. This question's frequent appearance makes it crucial for your preparation. A client with polycystic kidney disease, PKD, is being evaluated to determine if treatment goals are being met. Which finding would indicate successful management of the disease? A. Creatinine, 2.3 meager, DL. B. Presence of protein in the urine. C. Serum sodium level of 132 MEq L. D. Blood pressure 128/63 mmHg. The correct answer is D. Blood pressure 128/63 Hg. D is correct because a well-controlled blood pressure suggests that hypertension, a common complication of PKD, is being effectively managed. Proper blood pressure control is crucial in slowing the progression of kidney damage in PKD. A is incorrect because elevated creatinine levels indicate impaired kidney function, suggesting that the disease is not being adequately managed. B is incorrect because proteinuria indicates glomerular damage and worsening kidney function, which would suggest poor management of PKD. C is incorrect because a low sodium level suggests hyponatremia, indicating poor kidney function and inadequate disease management. This bradycardia-related question has been asked 4 times in the last 5 years. It's a key concept that has been tested multiple times. A client presents with vital signs including a pulse rate of 54 beats per minute. Which prescribed medication should the nurse verify with the healthcare provider before administration? A. Albuterol, 2.5 milliliters via nebulizer. B. Atenolol, 50 ml per oral daily. C. Spironolactone, 25 mg per oral daily. D. Simvastatin, 40 mg per oral daily. The correct answer is B. Atenolol, 50 mg per oral daily. B is correct because atenolol is a beta blocker that decreases heart rate. Administering it to a client with a pulse rate of 54 BPM could lead to dangerously low heart rates, potentially resulting in symptomatic bradycardia or heart block. It is crucial to verify this medication with the healthcare provider to avoid adverse outcomes. A is incorrect because albuterol may increase heart rate due to its beta agonistic effects and is not the medication of concern in this scenario. C is incorrect because spironolactone primarily affects blood pressure and electrolyte balance, not heart rate, and there is no need to verify this medication based on the pulse rate alone. D is incorrect because simvastatin manages cholesterol levels and does not affect heart rate, making it safe to administer. This abdominal assessment-related question has been asked 5 times in the last 5 years. The nurse is conducting a comprehensive physical examination and reaches the abdominal assessment. What is the correct sequence of actions? A. Percuss the abdomen, then listen to bowel sounds, palpate, and finally inspect. B. Listen to bowel sounds, visually inspect, palpate, then percuss. C. Visually inspect, palpate, listen to bowel sounds, then percuss. D. Visually inspect, listen to bowel sounds, percuss, then palpate. The correct answer is D. Visually inspect, listen to bowel sounds, percuss, then palpate. D is correct because this sequence ensures that the least invasive techniques are performed first, which is crucial for an accurate abdominal assessment. Inspection identifies visible abnormalities. Auscultation assesses bowel sounds without altering them through manipulation. Percussion determines abdominal contents density. And palpation, being the most invasive step, is last to avoid altering bowel sounds or causing discomfort. A is incorrect because the sequence should start with the least invasive technique, which is inspection. B is incorrect because the visual assessment should always precede any other actions. C is incorrect because palpation before auscultation can alter bowel sounds, leading to inaccurate findings. This complementary therapy-related question has been asked 6 times in the last 5 years. A client undergoing chemotherapy expresses interest in using complementary therapies, citing a friend's success. What is the most appropriate nursing response? A. Have you considered talking to your family about this idea? B. Could you tell me more about the types of complementary therapies your friend used? C. Complementary therapies might interfere with your chemotherapy. D. Can you clarify what you mean by complementary therapies? The correct answer is D. Can you clarify what you mean by complementary therapies? D is correct because the nurse should first seek to understand exactly what the client means by complementary therapies. This allows the nurse to gather specific information about the client's interests and concerns, which can then be discussed with the healthcare provider to determine if these therapies are safe and appropriate to use alongside chemotherapy. A is incorrect because the nurse's priority should be to understand the client's perspective and the specific complementary therapies they are considering before involving others. B is incorrect because it shifts the focus away from the client's needs and concerns. C is incorrect because, although true, this response is not therapeutic. It does not invite further discussion or exploration of the client's thoughts and feelings. This cancer-related question has been asked 7 times in the last 5 years, which means it's highly likely to appear in your exam. This question is also considered a favorite of the board, making it one of the most important to review. A nurse is attending to a terminal cancer patient who passes away while wearing a fentanyl patch for pain relief. What should the nurse do next? A. Safely remove and discard the fentanyl patch as per facility protocol, generally in a child-safe container. B. Take off the patch and advise the family to return it to a pharmacy. C. Leave the patch in place for the morgue staff to handle later. D. Allow the family to manage the removal and disposal of the patch. The correct answer is A. Safely remove and discard the fentanyl patch as per facility protocol, generally in a child-safe container. A is correct. The nurse is responsible for removing the fentanyl patch after the patient's death and ensuring it is properly discarded following hospital guidelines. Typically, this involves folding the patch with the sticky sides together and disposing of it in a designated secure container to avoid misuse or accidental exposure. The nurse should document the disposal in the medication administration record, so AR, to maintain accountability. B is incorrect. Once a fentanyl patch has been used, it cannot be returned to a pharmacy as it poses a risk of overdose or misuse. Instructing the family to handle the patch could result in accidental exposure to fentanyl, a potent opioid. C is incorrect. It is not appropriate to leave the fentanyl patch for the morgue staff to remove. Morgue personnel are typically not trained to handle opioid medications, and leaving it in place could create safety concerns for others who come into contact with the body. D is incorrect. The family should not be asked to remove or dispose of the fentanyl patch themselves, as they are not trained to handle such medications safely. This could lead to unintentional harm, including the risk of opioid overdose. Let's move on to the next question. This AKI-related question has been asked 6 times over the last 5 years, so there's a strong chance it will come up in the exam. A nurse is discussing acute kidney injury, AKI, with a nursing student. Which of the following would represent a prerenal cause of AKI? A. Medication-induced kidney damage. B. Tumor obstructing urinary flow. C. Radiographic contrast dye. D. Significant loss of body fluids. The correct answer is D. Significant loss of body fluids. D is correct. Prerenal acute kidney injury results from decreased blood flow to the kidneys, often caused by factors outside of the kidneys. Hypovolemia, or a significant loss of bodily fluids, is a common prerenal cause because it reduces the perfusion to the kidneys. This can result from hemorrhage, dehydration, or severe burns, all of which lower the effective blood volume reaching the kidneys. A and C are incorrect. Both nephrotoxic medications and contrast dyes are examples of intrarenal causes, which directly damage the kidney tissues themselves. These are not categorized as prerenal since the damage is internal to the kidneys. B is incorrect. A tumor causing obstruction is considered a postrenal cause of AKI, as it involves blocking the flow of urine after it has left the kidneys, leading to a backflow of urine and kidney damage. Let's continue with the next question. This prioritization question has appeared 8 times in the last 5 years, making it highly probable that you will see it in the exam. The nurse must prioritize care for the following clients. Which patient should the nurse see first? A. A patient receiving chemotherapy through a PICC line, reporting skin blistering at the insertion site. B. A patient receiving chemotherapy who is experiencing nausea and vomiting. C. A patient on oral chemotherapy complaining of mouth soreness when drinking citrus juice. D. A patient undergoing external radiation, sitting with family in the waiting room. The correct answer is A. A patient receiving chemotherapy through a PICC line, reporting skin blistering at the insertion site. A is correct. Skin blistering at the site of a peripherally inserted central catheter, PICC, used for chemotherapy, is a serious issue. This could indicate extravasation, where chemotherapy drugs leak into the surrounding tissue, potentially causing severe damage. The nurse should prioritize this patient, stop the infusion immediately, and assess the site to prevent further complications, such as tissue necrosis or infection. B is incorrect. Nausea and vomiting are common side effects of chemotherapy and can be managed with antiemetics. While these symptoms require attention, they are not immediately life-threatening. C is incorrect. Mouth sores or oral discomfort during chemotherapy are typically signs of mucositis, which is a known side effect of the treatment. Although painful, this situation is less urgent than a possible extravasation injury. D is incorrect. A patient sitting in the waiting room after external radiation does not appear to be experiencing any immediate health concerns requiring urgent intervention. Let's proceed to the next question. This ABG-related scenario has been asked 5 times in the last 5 years, which means it has a good chance of appearing in the exam. A patient overdoses on clonazepam, a benzodiazepine. Which arterial blood gas ABG result is most likely? A. Metabolic acidosis. B. Fully compensated metabolic alkalosis. C. Respiratory alkalosis. D. Respiratory acidosis. The correct answer is D. Respiratory acidosis. D is correct. Clonazepam is a central nervous system depressant, which can reduce the respiratory rate, leading to hypoventilation. This results in CO2 retention in the body, lowering blood pH, which causes respiratory acidosis. The body's inability to eliminate CO2 through proper ventilation is the primary reason for this change in the ABG results. A is incorrect. Metabolic acidosis occurs due to metabolic imbalances, such as diabetic ketoacidosis or renal failure, and is not directly related to respiratory depression from benzodiazepines like clonazepam. B is incorrect. Metabolic alkalosis results from conditions that increase bicarbonate or result in a loss of acid, such as vomiting or diuretic use. Clonazepam overdose would not lead to this. C is incorrect. Respiratory alkalosis occurs in cases of hyperventilation, where excessive breathing reduces CO2 levels, causing an increase in blood pH. This is the opposite of what happens in clonazepam overdose, which results in slowed breathing and CO2 retention. Let's review the next question. This question related to Bell's palsy has been asked 10 times, making it one of the most important topics to study. When creating a care plan for a patient diagnosed with Bell's palsy, which issue should be the top priority? A. Potential for infection. B. Risk of altered sensory perception. C. Concerns about body image. D. Reduced tissue perfusion risk. The correct answer is B. Risk of altered sensory perception. B is correct. Bell's palsy primarily affects facial muscles and sensory perception, particularly the ability to close the eye or chew properly. The nurse should prioritize the risk of sensory deficits, as these could lead to further complications such as corneal damage from incomplete eye closure or choking from difficulty chewing. Addressing these sensory and motor deficits can prevent injury and improve the patient's comfort and safety. A is incorrect. While Bell's palsy may involve inflammation of the facial nerve, it does not typically increase the risk of infection. The primary concern revolves around sensory and motor function. C is incorrect. Although facial asymmetry from Bell's palsy can impact body image and self-esteem, this is a psychological concern that is secondary to addressing the patient's immediate physiological needs. D is incorrect. Bell's palsy does not involve impaired tissue perfusion, as it does not affect blood circulation in the body. Let's move on to the next question. This postpartum care question has been asked 9 times over the last 5 years, making it one of the most frequently repeated questions by the board. It has a very high probability of showing up on the exam. A nurse is assessing a postpartum client 24 hours after delivery and notices that her fundus is firm but displaced slightly to the right. What is the nurse's next step? A. Evaluate for bladder fullness. B. Check the client's blood pressure. C. Review if oxytocin was administered. D. Count the number of used pads. The correct answer is A. Evaluate for bladder fullness. A is correct. When the fundus is firm but displaced, It often indicates that the bladder is full and pushing the uterus out of its normal midline position. A distended bladder can hinder the uterus from contracting properly, increasing the risk of postpartum hemorrhage. The nurse should encourage the client to empty her bladder and then reassess the fundal position. B is incorrect. Although monitoring vital signs like blood pressure is important in postpartum care, it is not directly relevant to the displaced fundus in this scenario. The priority is assessing the bladder. C is incorrect. Since the fundus is already firm, checking if oxytocin was given is unnecessary. Oxytocin is used to stimulate uterine contractions, but the uterus has already contracted. D is incorrect. Counting the number of used pads would be more relevant in cases of suspected heavy bleeding or hemorrhage. In this case, the nurse is concerned with the bladder affecting uterine position. Let's move to the next question. This snake bite related question has been asked 7 times in the last 5 years, making it highly likely to appear in the exam. A camp counselor is receiving instructions from a nurse about managing snake bites to an extremity. Which of the following should the nurse emphasize in the teaching? A. Apply a tourniquet just above the bite area. B. Keep the affected limb elevated higher than the heart. C. If possible, capture the snake to help with identification. D. Avoid placing ice on the bite site. The correct answer is D. Avoid placing ice on the bite site. D is correct. Ice should not be applied to a snake bite because it can exacerbate tissue damage by decreasing blood flow to the area and promoting localized necrosis. A is incorrect. A tourniquet should never be used for a snake bite, as it can increase the risk of severe tissue injury by restricting blood flow and concentrating venom in the affected area. B is incorrect. The extremity should be kept at heart level, not above, to help slow the spread of venom. Elevating the limb could speed up venom distribution. C is incorrect. Attempting to capture the snake is dangerous and increases the risk of additional bites. It's better to take a photo of the snake from a safe distance if possible. Let's move to the next question. This delegation-related question has been asked 6 times in the last 5 years and may likely show up in the exam. A senior nurse is guiding a new RN through their role as charge nurse. What delegated task assigned to the LPN/LVN would necessitate a follow-up by the charge nurse? A. Collecting a stool sample for occult blood testing in a patient with ulcerative colitis. B. Assessing a newly admitted patient presenting with chest pain. C. Reinforcing diabetes education for a recently diagnosed patient. D. Providing pin care to a patient with wrist external fixation. The correct answer is B. Assessing a newly admitted patient presenting with chest pain. B is correct. Assessment, particularly of a newly admitted patient with chest pain, falls within the RN's scope of practice, not the LPN/LVN's. Assessment requires critical analysis and decision-making, making it inappropriate to delegate to an LPN. A is incorrect. LPN/LVNs can collect stool samples for occult blood testing as part of routine care. This task does not require critical thinking or assessment. C is incorrect. LPN/LVNs can reinforce teaching initially provided by an RN, such as reviewing key information with a patient newly diagnosed with diabetes. D is incorrect. Pin care for external fixation, which involves cleaning and ensuring sterility at the site, is a task appropriate for an LPN or LVN under the RN's supervision. Let's proceed with the next question. This non-stress test, NST question, has appeared 8 times over the last 5 years, indicating a high probability of recurrence in the exam. A nurse evaluates a pregnant client's non-stress test and notes that it is reactive. What does this result indicate? A. Fetal heart rate accelerations are less than 15 beats per minute or last less than 15 seconds. B. No late decelerations are present in the fetal heart rate. C. Late decelerations occur with at least half of the contractions. D. There are 2 or more fetal heart rate accelerations within a 20-minute window. The correct answer is D. There are 2 or more fetal heart rate accelerations within a 20-minute window. D is correct. A reactive non-stress test is a reassuring sign of fetal well-being, indicated by at least 2 accelerations of the fetal heart rate that are 15 BPM above baseline for at least 15 seconds within a 20-minute monitoring period. A is incorrect. Accelerations of less than 15 BPM or lasting less than 15 seconds would suggest a non-reactive, concerning result. B is incorrect. This statement refers to a contraction stress test, CST, not a non-stress test, NST, and the absence of late decelerations is indicative of a negative CST, which is also a good result, but unrelated to NST criteria. C is incorrect. Late decelerations in more than 50% of contractions would indicate a positive CST, which is a non-reassuring finding and signals potential fetal distress. Let's move on to the next question. This immobility-related question has been asked 5 times over the last 5 years and is a common topic in exams. A new nurse is learning about contractures related to immobility. Which statement reflects accurate knowledge about contractures? A. Muscle spasticity makes preventing contractures impossible. B. Contractures are unavoidable due to muscle tension. C. Flexion contractures are among the least common types of contractures. D. Flexion contractures are among the most frequently occurring types of contractures. The correct answer is D. Flexion contractures are among the most frequently occurring types of contractures. D is correct. Flexion contractures are the most frequently encountered type, particularly in patients with limited mobility. These contractures commonly affect joints like the hips and knees, especially in patients with conditions such as neuromuscular disorders or after lower extremity amputations. A is incorrect. Contractures can be prevented through regular movement, proper positioning, and range of motion exercises, even in cases where muscle spasticity is present. B is incorrect. Prevention of contractures is possible by maintaining proper limb alignment and mobility, and muscular tension alone does not make them inevitable. C is incorrect. Flexion contractures are not rare. They are the most common, particularly in patients with prolonged immobility. Let's continue with the next question. This enema-related question has been asked 4 times over the last 5 years and has a good chance of showing up on the exam. The nurse is about to administer an enema to a client. What is the appropriate position to place the client in prior to the procedure? A. Trendelenburg's position. B. Semi-Fowler's position. C. Left lateral position. D. Right lateral with the head of the bed lowered. The correct answer is C. Left lateral position. C is correct. The left lateral position, also known as the Sims position, is recommended when administering an enema because it facilitates the flow of the solution into the colon by following the natural path of the large intestine. A is incorrect. Trendelenburg's position, where the head is lower than the feet, is not suitable for enema administration and would work against gravity in this case. B is incorrect. Semi-Fowlers, with the client sitting at an incline, would not aid in the administration of an enema and could result in ineffective distribution of the solution. D is incorrect. The right lateral position is less effective for enema administration, as the solution might not flow through the colon as efficiently as in the left lateral position. Let's move to the next question. This avulsion fracture-related question has been asked 6 times in the past 5 years and is likely to appear in the exam. A 7-year-old client with an avulsion fracture of the left tibia is en route to the emergency department. What does the nurse expect this type of fracture to involve? A. A piece of bone is pulled away by a tendon or ligament. B. The bone is fractured across its entire cross-section. C. The fracture results from an underlying disease, not trauma. D. Only one side of the bone is fractured. The correct answer is A. A piece of bone is pulled away by a tendon or ligament. A is correct. An avulsion fracture occurs when a small piece of bone is torn away from the main bone mass by a tendon or ligament. This injury often happens during high-stress physical activities. B is incorrect. A fracture across the entire cross-section of a bone is referred to as a complete fracture, which is different from an avulsion fracture. C is incorrect. Fractures caused by diseases weakening the bone, such as osteoporosis or cancer, are termed pathological fractures. D is incorrect. A fracture affecting only one side of the bone, typically seen in children, is called a green stick fracture. Let's move to the next question. This cataract surgery-related question has been asked 9 times over the last 5 years and is highly probable to appear in the exam. A nurse is providing discharge instructions to a client following cataract surgery with lens implantation. Which statement by the client demonstrates correct understanding? A. I need to avoid getting water in my eye for the next 3 to 7 days. B. I can resume normal household tasks like vacuuming right away. C. Green or yellow discharge from my eye is normal. D. Aspirin is fine to take if I have any pain after surgery. The correct answer is A. I need to avoid getting water in my eye for the next 3 to 7 days. A is correct. After cataract surgery, keeping water out of the eye for 3 to 7 days is essential to avoid contamination and reduce the risk of infection. B is incorrect. Vacuuming involves bending and lifting, which can increase intraocular pressure. These activities should be avoided in the early recovery period. C is incorrect. While some white or slightly blood-tinged discharge is normal post-surgery, green or yellow discharge could indicate an infection and requires immediate medical attention. D is incorrect. Aspirin is generally avoided due to its blood-thinning properties, which can increase the risk of bleeding. Acetaminophen is preferred for post-operative pain relief. Let's move on to the next question. This otitis media-related question has been asked 8 times over the last 5 years and is very likely to appear in the exam. A pediatric nurse is assessing an infant with acute otitis media. Why is this condition more common in infants than adults? A. The infant's cardiac sphincter is immature. B. Feeding in a semifolar position contributes to ear infections. C. The introduction of solid foods increases infection risk. D. Infants have shorter, more horizontal eustachian tubes. The correct answer is D. Infants have shorter, more horizontal eustachian tubes. D is correct. Infants are more prone to otitis media due to their shorter, narrower, and more horizontally positioned eustachian tubes, which makes fluid drainage from the middle ear less effective and increases the likelihood of infection. A is incorrect. An immature cardiac sphincter primarily affects gastroesophageal reflux and is unrelated to ear infections. B is incorrect. Feeding in a semi-fowler position helps reduce the risk of ear infections, as it prevents fluid from pooling in the middle ear. C is incorrect. The introduction of solid foods does not increase the risk of otitis media. Let's move on to the next question. This hypernatremia-related question has been asked 5 times in the past 5 years and is moderately likely to appear in the exam. A nurse is treating a client with hypernatremia. Which intravenous fluid would be most appropriate for this condition? A. Dextrose, 5% in water, D5W. B. 3% saline. C. Lactated ringers with dextrose, 5%, D5LR. D. 0.9% saline. The correct answer is A, dextrose 5% in water, D5W. A is correct. Dextrose 5% in water is an appropriate choice for hypernatremia because it provides free water without adding sodium, helping to lower the client's elevated sodium levels. B is incorrect. 3% saline is a hypertonic solution and would further increase sodium levels, worsening the client's hypernatremia. C is incorrect. Lactated ringers with dextrose 5% contain sodium and would be inappropriate for a client with high sodium levels. D is incorrect. Normal saline, 0.9% saline, also contains sodium and would not help in reducing the sodium levels in a hypernatremic patient. Let's continue to the next question. This cystic fibrosis-related question has been asked 6 times in the last 5 years and is a common exam topic. A nurse is providing education to the parents of a child with cystic fibrosis. Which statement by the parents would require correction? A. We should do chest physiotherapy before giving bronchodilators. B. It's important to give the bronchodilator before exercise. C. The bronchodilator may interfere with sleep if given at night. D. Our child should drink more water during respiratory infections. The correct answer is A. We should do chest physiotherapy before giving bronchodilators. A is correct. Chest physiotherapy should be performed after administering bronchodilators, as the medication helps open the airways and makes it easier to clear secretions during physiotherapy. B is incorrect. Administering a bronchodilator before strenuous activity is recommended to help prevent exercise-induced bronchoconstriction. C is incorrect. Bronchodilators may cause hyperactivity or sleep disturbances if given late in the day due to their stimulant effects. D is incorrect. Increasing fluid intake during respiratory illness is encouraged to help thin secretions and ease expectoration. Let's proceed with the final question. This anthrax exposure-related question has been asked 4 times over the last 5 years and has a moderate likelihood of appearing in the exam. A nurse in the emergency department is caring for a client exposed to inhalation anthrax. What is the nurse's priority action? A. Begin continuous pulse oximetry monitoring. B. Obtain an order for a chest X-ray. C. Notify the local public health department. D. Prepare the client for a lumbar puncture. The correct answer is A. Begin continuous pulse oximetry monitoring. A is correct. Monitoring the client's oxygen levels is crucial in the case of inhalation anthrax because respiratory compromise can occur rapidly. Continuous pulse oximetry ensures early detection of hypoxia, allowing for timely intervention. B is incorrect. Obtaining a chest X-ray is important, but secondary to monitoring the client's oxygenation status. C is incorrect. Notifying public health authorities is necessary, but ensuring the client's respiratory status is stable takes precedence. D is incorrect. Preparing for a lumbar puncture is not immediately relevant to the management of inhalation anthrax exposure. This question related to suicidal ideation has been asked 8 times in the last 5 years, making it highly likely to appear in your exam. The nurse is creating a care plan for a patient with suicidal thoughts. What is the primary focus when providing care for this client? A. Build a supportive therapeutic relationship. B. Secure the environment by locking cabinets and removing harmful items. C. Request a prescription for an antidepressant. D. Schedule appropriate group therapy sessions. The correct answer is B. Secure the environment by locking cabinets and removing harmful items. B is correct. The most critical intervention for a client with suicidal ideations is ensuring their safety by removing potential tools for self-harm from the environment, such as locking cabinets that contain sharp objects or harmful substances. This creates a safe space and minimizes the risk of the client accessing anything that could be used in a suicide attempt. A is incorrect. While establishing a therapeutic relationship is crucial for helping the client express their feelings, it does not take precedence over physical safety. Ensuring a secure environment is the immediate priority when managing a client with active suicidal ideations. C is incorrect. Prescribing antidepressants might be part of the treatment plan, but the immediate priority is ensuring safety. Medication can take time to work, and physical safety needs to be secured in the meantime. D is incorrect. Group therapy may be beneficial in the long-term care of the client, but it is not a primary intervention when addressing acute suicidal ideation. This Erickson developmental stage-related question has been asked 6 times over the last 5 years, so there's a strong chance it will come up in the exam. A nurse is evaluating a 4-year-old child. According to Erickson's developmental stages, which phase is this child likely in? A. Trust versus mistrust. B. Initiative versus guilt. C. Identity versus role confusion. D. Industry versus inferiority. The correct answer is B. Initiative versus guilt. B is correct. The stage of initiative versus guilt typically applies to preschoolers aged 3 to 5 years. During this period, children begin to take initiative, making decisions and asserting control over their world. Success in this stage fosters a sense of initiative, while failure can result in feelings of guilt. This aligns with the developmental tasks of a 4-year-old child. A is incorrect. Trust versus mistrust occurs from birth to around 18 months, where infants develop trust when caregivers are reliable and nurturing. This stage does not apply to a 4-year-old. C is incorrect. Identity versus role confusion is typical for adolescents aged 12 to 18 years. During this phase, individuals work on developing a strong personal identity. D is incorrect. Industry versus inferiority is associated with school-age children, 6 to 11 years old, as they work on mastering new skills and tasks. This stage comes after initiative versus guilt. This diabetes and exercise-related question has appeared 5 times in the last 5 years, making it a common topic on the exam. A nurse is providing education on exercise for a client with type 1 diabetes. Which client statement reflects a proper understanding of the information? A. I should carry a high-protein snack in case I start feeling shaky. B. I'll skip my daily glargine insulin dose if I plan to exercise. C. At first, my blood sugar may go up during exercise, but it could drop after a while. D. It's best to exercise when my insulin is peaking. The correct answer is C. At first, my blood sugar may go up during exercise, but it could drop after a while. C is correct. During exercise, the body initially releases stress hormones, like adrenaline, which can cause a temporary spike in blood glucose. As the exercise continues, the muscles begin to use glucose for energy, which can cause blood glucose levels to fall. Understanding this fluctuation is important for managing blood sugar levels while exercising. A is incorrect. A snack containing carbohydrates, not protein, is best for treating hypoglycemia during exercise. Fast-acting carbohydrates, such as glucose tablets or juice, can quickly raise blood glucose levels if they fall. B is incorrect. Glargine is a long-acting insulin and should not be skipped before exercise. Skipping it could lead to poor long-term blood glucose control. Adjustments should be made based on the healthcare provider's recommendations. D is incorrect. It is not advisable to exercise when insulin is at its peak action time because this increases the risk of hypoglycemia. Exercises should be scheduled during periods when insulin levels are stable. This medication education-related question has been asked 7 times in the past 5 years, making it highly probable to appear on the exam. A nurse is educating a client about newly prescribed enalapril. What key information should the nurse emphasize? A. You might develop a dry cough while on this medication. B. Report any swelling of your face, lips, or eyes to your doctor immediately. C. You may notice some foods taste different. D. You'll need to get periodic blood tests while taking this medication. The correct answer is B. Report any swelling of your face, lips, or eyes to your doctor immediately. B is correct. Enalapril is an ACE inhibitor, and it's crucial to inform the client about the possibility of angioedema, which can cause swelling of the face, lips, or throat, and may lead to airway obstruction. This is a serious side effect that requires immediate medical attention. A is incorrect. While a dry cough is a common side effect of ACE inhibitors, it is not life-threatening like angioedema, making it a lower priority in client education. C is incorrect. Altered taste is another non-life-threatening side effect of ACE inhibitors. Clients should avoid adding extra salt to compensate for taste changes, but this is not a priority over the risk of angioedema. D is incorrect. Regular blood tests are important to monitor kidney function and potassium levels, but this is not as urgent as recognizing the symptoms of angioedema. This pregnancy-related question has been asked 9 times over the last 5 years, making it one of the most frequently repeated questions by the board. At 25 weeks gestation, a pregnant client presents with smaller than expected uterine size, decreased fetal movement, and an easily palpable fetus. What is the most likely cause? A. Oligohydramnios. B. Macrosomia. C. Hydramnios. D. Amniotic fluid embolism. The correct answer is A. Oligohydramnios. A is correct. Oligohydramnios, or low amniotic fluid, can result in reduced uterine size and decreased fetal movement because there is less fluid cushioning the baby. This makes the fetus easier to palpate during the exam. B is incorrect. Macrosomia refers to a larger than average baby, typically over 8 lbs 13 Aussie at birth, which would not correlate with the described signs of small uterine size and reduced fetal movement. C is incorrect. Hydramnios, also called polyhydramnios, is an excess of amniotic fluid, which would lead to a larger than expected uterine size, not a smaller one. D is incorrect. Amniotic fluid embolism is a rare and life-threatening condition that occurs when amniotic fluid enters the mother's bloodstream, leading to respiratory collapse, which is unrelated to the described symptoms. This pediatric suction-related scenario has been asked 4 times in the past 5 years, making it moderately likely to appear in the exam. A nurse is preparing to suction an 8-month-old infant's tracheostomy due to visible secretions. Which suction setting is most appropriate? A. 120 mm. B. 90 mm. C. 60 mm. D. 40 mm. The correct answer is B. 90 mm. B is correct. For an infant, the appropriate suction setting is between 80 to 100 mm, making 90 mm the best option. This pressure is safe for infants and will effectively clear secretions without causing trauma to the delicate tracheal tissue. A is incorrect. 120 mmHg is too high for an 8-month-old infant and is more appropriate for older children or adults. Suctioning at too high a pressure could cause damage to the trachea or lungs. C is incorrect. 60 mm is the recommended suction setting for neonates up to 28 days old, but it would likely be inadequate for an 8-month-old infant. D is incorrect. 40 mm is too low to effectively suction the trachea of an infant and would not clear the secretions properly. This defense mechanism-related scenario has been asked 5 times in the last 5 years, making it a frequent topic in exams. During an office visit, a nurse observes a client being yelled at by their spouse. When the nurse interviews the client lashes out in anger. Which defense mechanism is the client displaying? A. Identification. B. Displacement. C. Undoing. D. Compensation. The correct answer is B. Displacement. B is correct. Displacement occurs when a person redirects their emotional response from the original source of stress to a less threatening target. In this case, the client is redirecting the anger from the spouse to the nurse. Displacement helps individuals express emotions that may be socially unacceptable in the original context. A is incorrect. Identification involves mimicking or adopting the behaviors of others to cope with feelings of inadequacy, which does not fit the scenario. C is incorrect. Undoing involves trying to reverse or undo a thought or behavior, typically due to guilt. This is not evident in the client's hostile response. D is incorrect. Compensation involves focusing on strengths to make up for perceived weaknesses. This does not match the client's behavior in this context. This delegation-related question has been asked 6 times over the last 5 years, making it a common exam topic. An RN and an LPN-VN are working together in a psychiatric unit. Which client can the RN assign to the LPN-VN? A client taking amitriptyline who is grimacing and grinding their teeth. B. A client with dementia who is confused and disoriented. C. A client with a lithium level of 2.0 MEQ2L. D. A client with chronic alcoholism experiencing delirium tremens. The correct answer is B. A client with dementia who is confused and disoriented. B is correct. Dementia is a chronic and progressive condition, and confusion and disorientation are common symptoms. In the absence of any acute changes, this client is stable and appropriate for the LPN-VN to manage under the supervision of the RN. A is incorrect. The grimacing and jaw movements suggest possible dystonia, a potentially serious side effect of amitriptyline that requires immediate assessment by an RN. This client needs close monitoring and possible interventions, making them inappropriate for assignment to an LPN-VN. C is incorrect. A lithium level of 2.00 MEQ-L indicates severe lithium toxicity, which is a medical emergency. This client requires immediate intervention and management, including possible transfer to a higher level of care, which is outside the scope of an LPN-VN. D is incorrect. Delirium tremens is a severe and potentially life-threatening form of alcohol withdrawal. This condition requires frequent monitoring and specialized care, making it inappropriate for delegation to an LPN-VN. This oral care-related question has been asked 4 times in the past 5 years, making it moderately likely to appear on the exam. The nurse is educating a client with stomatitis on proper oral care. Which recommendation is appropriate? A. Use alcohol-based mouthwash to rinse the mouth. B. Provide lemon glycerin swabs between meals. C. Rinse the mouth with saline solution. D. Use chlorhexidine to clean the mouth. The correct answer is C. Rinse the mouth with saline solution. C is correct. For a client with stomatitis, inflammation of the oral mucosa, using a saline solution is recommended as it is gentle and non-irritating. Saline or a saline bicarbonate solution helps maintain oral hygiene without exacerbating the condition. A is incorrect. Alcohol-based mouthwashes can be irritating to the inflamed mucosa and should be avoided in clients with stomatitis. B is incorrect. Lemon glycerin swabs can be acidic and irritating to the oral mucosa, worsening the symptoms of stomatitis. D is incorrect. Chlorhexidine can also be harsh on sensitive or inflamed tissues, and it is not the best option for clients with stomatitis. Let's move to the next question. This newborn-related question has been asked 6 times in the last 5 years, so there's a good chance it may come up again in your exam. A nurse is assessing a newborn born less than 2 hours ago. Which of the following findings would require further investigation? A. A diamond-shaped soft area at the top of the newborn's head. B. A greasy white substance covering the neck, back, and thighs. C. A single crease on the palm. D. Acrocyanosis. The correct answer is C. A single crease on the palm. C is correct. A single transverse palmar crease, also known as a simian line, can be associated with certain genetic conditions, such as Down syndrome. This finding requires further evaluation to rule out chromosomal abnormalities. A is incorrect. The diamond-shaped soft area on the top of the newborn's head is the anterior fontanelle, which is a normal finding. It allows the baby's skull to compress during birth and continue growing after birth. B is incorrect. The greasy white substance is vernix caseosa, a normal protective covering present on the skin of many newborns, which helps protect the baby's skin in the womb. D is incorrect. Acrocyanosis, or bluish discoloration of the hands and feet, is common in newborns shortly after birth and is generally not a cause for concern. Let's move to the next question. This domestic violence-related question has been asked 7 times in the past 5 years, making it highly likely to be repeated in the exam. A client presents to the emergency department with multiple burns and bruises, stating that her spouse inflicted the injuries. What should the nurse do first? A. Assess and treat the injuries. B. Contact a social worker for discharge planning. C. Establish a therapeutic rapport. D. Report the abuse to authorities. The correct answer is A. Assess and treat the injuries. A is correct. The priority in this situation is to assess and treat the client's physical injuries. Ensuring the client's safety and addressing any medical concerns should be the first step before any other actions are taken. B is incorrect. Consulting a social worker is important for discharge planning and safety, but it should occur after the client's immediate physical needs are addressed. C is incorrect. While establishing rapport is necessary for therapeutic communication, it should not take precedence over treating the injuries. D is incorrect. While mandatory reporting of abuse is required, it should occur after the client's physical needs are addressed. Let's move on to the next question. This oxygen therapy-related question has appeared 5 times over the last 5 years, so it's quite likely to show up in the exam. A client with acute pulmonary edema has a pulse oximetry reading of 86% on room air. Which oxygen delivery device should the nurse apply? A. Simple face mask. B. Nasal cannula. C. Non-rebreather mask. D. Partial rebreather mask. The correct answer is C. Non-rebreather mask. C is correct. A non-rebreather mask delivers the highest concentration of oxygen, up to 95%, and is used in emergencies such as acute pulmonary edema when the client is at risk for respiratory failure. Immediate intervention with high concentration oxygen is essential to stabilize the client. A is incorrect. A simple face mask provides lower oxygen concentrations than a non-rebreather mask and would not be sufficient in this emergency situation. B is incorrect. A nasal cannula provides a much lower oxygen concentration, 24 to 44%, and would not meet the client's needs in this case of severe oxygen deficiency. D is incorrect. A partial rebreather mask delivers a higher concentration of oxygen than a nasal cannula, but is still less effective than a non-rebreather mask in a critical situation like pulmonary edema. Let's move to the next question. This DVT diagnosis-related question has been asked 6 times in the past 5 years, so it is quite likely to appear in the exam. A nurse assesses a client with acute left leg swelling and calf tenderness following a long car ride. Which diagnostic test is most likely to be ordered by the healthcare provider? A. D-dimer test. B. Ankle brachial index. C. Radiograph. X-ray. D. Venous duplex. Ultrasonography. The correct answer is D. Venous duplex ultrasonography. D is correct. Venous duplex ultrasonography is the gold standard for diagnosing deep vein thrombosis, DVT, which is suspected in this client based on unilateral leg swelling and tenderness following a long period of immobility, a known risk factor for DVT. A is incorrect. The D-dimer test can indicate the presence of a clot, but it is not as definitive as a venous duplex ultrasound for diagnosing DVT. B is incorrect. The ankle brachial index is used to assess peripheral artery disease, not deep vein thrombosis. C is incorrect. A radiograph, X-ray, is not used to diagnose DVT as it does not provide sufficient detail of the blood vessels or clots. Let's continue with the next question. This Romberg test-related question has appeared 4 times in the last 5 years, making it a moderately frequent question that might appear in the exam. A healthcare provider wants to perform a Romberg test on a client with a neurologic injury. What instruction should the nurse give the client? A. Stand with your arms at your sides and your feet together. B. Flex your neck, bringing your chin to your chest. C. Place both elbows on the table with your forearms vertical and flex both wrists at 90 degrees. D. Place your left heel on your right shin and run it down the shin to the top of the foot. The correct answer is A. Stand with your arms at your sides and your feet together. A is correct. The Romberg test assesses a client's balance by having them stand with their feet together and arms at their sides. The provider will observe for swaying first with the eyes open and then with the eyes closed. B is incorrect. Flexing the neck and bringing the chin to the chest is a maneuver used to assess for signs of meningitis, not part of the Romberg test. C is incorrect. Placing the elbows on a table and flexing the wrists is part of a different test used to assess for carpal tunnel syndrome, Phelan's test. D is incorrect. Placing the heel on the shin and running it down assesses coordination, not balance, and is not part of the Romberg test. Let's proceed to the next question. This buccal administration-related question has been asked 3 times in the past 5 years, making it a less common but still important question for the exam. A healthcare provider prescribes medication via the buccal route. How should the nurse administer this medication? A. In the client's ear while holding the pinna down and back. B. Under the client's tongue. C. Between the client's cheek and gum. D. Into the client's nasal passage. The correct answer is C. Between the client's cheek and gum. C is correct. The buccal route involves placing the medication between the cheek and gum, where it can be absorbed through the mucous membranes, providing faster absorption than oral tablets. A is incorrect. This method describes administering eardrops, not buccal medication. B is incorrect. Placing medication under the tongue refers to sublingual administration, not buccal. D is incorrect. Administering medication into the nasal passage is the nasal route, not the buccal route. This question addresses a post-surgical complication frequently encountered in nursing care. Understanding appropriate interventions is crucial. The nurse is caring for a client with a paralytic ileus following an appendectomy. Which intervention would be appropriate for the nurse to take? A. Assess the client for hyperkalemia. B. Prepare for the insertion of a nasogastric tube. C. Assess the surgical wound for approximation. D. Instruct the client to chew their food more slowly. The correct answer is B. Prepare for the insertion of a nasogastric tube. B is correct because inserting a nasogastric NG tube helps relieve symptoms of paralytic ileus by decompressing the bowel, reducing abdominal distension, and preventing nausea and vomiting until bowel function returns to normal. A is incorrect because hyperkalemia is not typically associated with paralytic ileus. Hypokalemia is a more common electrolyte imbalance in ileus cases due to slowed gastrointestinal motility. C is incorrect because, although assessing the wound is important, it does not address the immediate concern of paralytic ileus. D is incorrect because clients with paralytic ileus are usually kept NPO, nothing by mouth. So chewing food more slowly would not resolve the condition. This question focuses on a crucial medication used to treat a severe neurological disorder. Knowledge of this is essential for safe medication administration. The nurse has received a prescription to administer thiamine to a client. The nurse understands that this medication is intended to treat A. Systemic lupus erythematosus. B. Pernicious anemia. C. Wernicke's encephalopathy. D. Iron deficiency anemia. The correct answer is C. Wernicke's encephalopathy. C is correct because thiamine is crucial for preventing and treating Wernicke's encephalopathy, a serious neurological disorder caused by thiamine deficiency, often associated with chronic alcohol abuse or malnutrition. A is incorrect because systemic lupus erythematosus is treated with immunosuppressive drugs such as corticosteroids and anti-malarial medications, not thiamine. B is incorrect because pernicious anemia is caused by a deficiency in vitamin B12, not thiamine, and is treated with B12 supplementation. D is incorrect because iron deficiency anemia is treated with iron supplementation, not thiamine. This question examines culturally competent care, an important aspect of nursing practice. Understanding different religious practices is essential for respectful care. The nurse is caring for a client who is of the Islamic faith who has died. Which appropriate action should the nurse take? A. Prepare the client for cremation. B. Position the client facing Mecca. C. Keep the client's eyelids open. D. Keep the client uncovered. The correct answer is B. Position the client facing Mecca. B is correct because, in Islamic practice, it is customary to position the deceased facing Mecca, the holy city of Islam, in preparation for burial. This is a sign of respect and religious observance. A is incorrect because cremation is forbidden in Islam. The deceased are buried according to Islamic customs. C is incorrect because the eyes of the deceased should be closed out of respect, in accordance with Islamic traditions. D is incorrect because the body should be covered in accordance with Islamic traditions, which dictate that the body should be treated with modesty and respect. This question focuses on post-stroke management, a critical concept in the care of clients with cerebrovascular accidents, CVA. The nurse is caring for a client who sustained an ischemic cerebrovascular accident, CVA, 3 hours ago. The client's most recent blood pressure was 168 Hau 101 mg Hg. The nurse should take which action? A. Position the head of the bed completely flat. B. Continue to monitor the client. C. Obtain orthostatic blood-pressure. D. Request a prescription for an antihypertensive. The correct answer is B. Continue to monitor the client. B is correct because, in cases of ischemic stroke, permissive hypertension is often allowed to maintain adequate cerebral blood flow. Unless blood pressure exceeds 185 on 110 mm Hg, aggressive lowering of blood pressure is typically avoided during the acute phase of ischemic stroke. A is incorrect because keeping the head of the bed flat can increase intracranial pressure, worsening the effects of the stroke. C is incorrect because measuring orthostatic blood pressure is not necessary for managing a client with an ischemic stroke. D is incorrect because antihypertensive therapy is typically withheld unless the blood pressure exceeds 185/110 mm Eg. This question focuses on the complications of mechanical ventilation, a key aspect of critical care nursing. The nurse is caring for a client receiving mechanical ventilation with positive end expiratory pressure, PEEP. The nurse should monitor the client for which complication? A. Decreased mean arterial pressure, MOPT. B. Increased preload. C. Increased partial pressure of oxygen. D. Increased gas exchange. The correct answer is A. Decreased mean arterial pressure, MAP. A is correct because PEEP increases intrathoracic pressure, which can reduce venous return to the heart, leading to a decrease in cardiac output and mean arterial pressure, MAP. B is incorrect because PEEP decreases venous return, which results in reduced preload, not increased preload. C is incorrect because, while PEEP may improve oxygenation by keeping the alveoli open, it is not a complication. D is incorrect because improved gas exchange is a desired outcome of PEEP, not a complication. This calculation-based question emphasizes the importance of accurate medication administration in clinical practice. The nurse cares for a client receiving 1,300 units per hour of heparin. The bag is labeled 25,000 units in 500 ml of dextrose, 5% in water. How many ml should the nurse record that the client received in 8 hours? A. 208 ml. B. 260 ml. C. 416 ml. D. 104 ml. The correct answer is option A, 208 ml. 1. Option A, 208 ml. This pediatric question focuses on a developmental milestone in infants. Understanding fontanelle closure is vital for pediatric assessments. A parent in a pediatric clinic asks the nurse when the soft spots on their baby's head will harden. The most appropriate response by the nurse would be A. These soft spots are called fontanelles. Typically, the one towards the front of the head closes between 12 and 18 months, and the one on the back of the head closes by 2 to 3 months old. B. These soft spots are called fontanelles. The one towards the front of the head closes at 2 months, and the one on the back closes at 12 to 18 months old. C. These soft spots are called fontanelles. The one on the front of the head closes between 12 and 18 months, and the one on the back closes around 6 months old. D. These soft spots are called fontanelles. The one on the front of the head closes at 9 months old, and the one on the back closes at 2 months old. The correct answer is A. These soft spots are called fontanelles. Typically, the one towards the front of the head closes between 12 and 18 months, and the one on the back of the head closes by 2 to 3 months old. A is correct because the anterior fontanelle, front soft spot, typically closes between 12 to 18 months, and the posterior fontanelle, back soft spot, closes by 2 to 3 months. This is the most accurate timeline for fontanelle closure. B is incorrect because it reverses the closure times for the anterior and posterior fontanelles. C is incorrect because the posterior fontanelle generally closes earlier than 6 months. D is incorrect because both fontanelle closure times are inaccurate. This question emphasizes dosage calculation, a key competency in safe nursing practice. The primary healthcare provider prescribes 3 liters of normal saline, that's 0.9% saline, to infuse over 24 hours. How many milliliters per hour will be administered to the client? A. 125 milliliters per hour. B. 100 milliliters per hour. C. 150 milliliters per hour. D. 200 milliliters per hour. Answer. The correct answer is A. 125 milliliters per hour. Explanation. Option A, 125 milliliters per hour. Oh, this is the correct answer. Here's how we calculate it. The total volume prescribed is 3 liters, which is the same as 3,000 milliliters. The infusion period is 24 hours. So, to figure out how many milliliters per hour, you divide 3,000 milliliters by 24 hours. This equals 125 milliliters per hour. Therefore, the client will receive 125 milliliters every hour. This question deals with a sensitive topic, child abuse, and how to recognize potential signs during an assessment. A nurse is speaking with the mother of a 3-year-old in the emergency department. After an assessment, the mother is suspected of abusing the toddler. Following a conversation between the nurse and the mother, which finding would most support the suspicion of maternal child abuse? A. The mother exhibits a healthy level of self-esteem. B. The mother describes the happy childhood she experienced. C. The mother complains her toddler seems to be different from others. D. The mother complains that her child seems to be growing up too quickly. The correct answer is C. The mother complains her toddler seems to be different from others. C is correct because a parent who views their child as different or more difficult than others may be at higher risk of engaging in abusive behavior. This finding is consistent with known risk factors for child abuse. A is incorrect because a healthy level of self-esteem in the mother does not suggest child abuse. B is incorrect because describing a happy childhood is not a typical indicator of abusive behavior. D is incorrect because complaining that a child is growing up too quickly does not indicate abuse. This question focuses on understanding arterial blood gas, ABG values, a fundamental skill in respiratory and critical care nursing. The nurse is participating in a conversation with the primary healthcare provider, PHCP, and a client's family regarding the experience of respiratory acidosis. What arterial blood gas, ABG values suggest this? A. pH 730, CO2 38, HCO3 18. B. pH 748, CO2 31, HCO3 24. C. pH 7.42, CO2 36, HCO3 24. D. pH 7.30, CO2 52, HCO3 29. The correct answer is D. pH 7.30, CO2 52, HCO3 29. D is correct because a low pH, acidosis, elevated CO2, and compensatory elevation in bicarbonate, HCO3, indicate respiratory acidosis. This condition occurs when the lungs are unable to effectively remove CO2, leading to acid buildup. A is incorrect because these ABG values suggest metabolic acidosis. B is incorrect because these ABG values indicate respiratory alkalosis. C is incorrect because these are normal ABG values, with no imbalances in CO2 or HCO3. Let's move to the next question. This pediatric hydrocephalus question has been asked 5 times in the last 5 years, so it's likely to appear in the exam. This is considered a crucial topic in pediatric care. A pediatric patient with hydrocephalus is scheduled for ventriculoperitoneal, VP, shunt placement. The nurse is preparing the patient for surgery. Which preoperative medication should the nurse expect to administer to decrease cerebrospinal fluid, CSF production, and facilitate the surgical procedure? A. Morphine sulfate. B. Acetaminophen. C. Mannitol. D. Ondansetron. The correct answer is C. Mannitol. C is correct. Mannitol is an osmotic diuretic that decreases intracranial pressure by drawing water out of brain tissue and reducing CSF production. Administering mannitol before surgery can facilitate the safe placement of the VP shunt in children with hydrocephalus. A is incorrect. Morphine sulfate is an opioid analgesic used to manage pain but does not reduce CSF production. B is incorrect. Acetaminophen is a non-opioid analgesic used to relieve pain and reduce fever. However, it does not affect CSF production and is not specifically required for this preoperative context. D is incorrect. Ondansetron is an antiemetic used to control nausea and vomiting, which may be useful during the postoperative period, but does not influence CSF production or assist in VP shunt surgery. Let's continue with the next question. This ostomy care question has been asked 6 times in the last 5 years, making it an important question on postoperative care in exams. A patient has recently undergone fecal diversion surgery and is preparing for discharge. What type of support network would be most beneficial for this patient in terms of self-care and adapting to their physical changes? A. A peer support group for ostomy care. B. An emotional support person to help with body image concerns. C. A practical support network to assist with daily living activities. D. Volunteers from a church to help with transportation to appointments. The correct answer is A. A peer support group for ostomy care. A is correct. A peer support group specifically for individuals with ostomies will help the patient learn practical skills for managing their ostomy and adapting to the new physical reality. These networks provide valuable tips, emotional encouragement, and shared experiences to improve the patient's ability to perform self-care. B is incorrect. While emotional support is important, the primary focus here is on acquiring self-care skills related to managing the ostomy. C is incorrect. Practical help with daily activities, like cooking or cleaning, may be helpful, but learning self-care techniques specific to the ostomy should be the priority in the early stages of recovery. D is incorrect. Though transportation to healthcare appointments is useful, it doesn't directly address the patient's most pressing need, which is learning to care for their ostomy independently. Let's move on to the next question. This group therapy question has been asked 4 times in the last 5 years, making it moderately likely to appear in the exam. During a group therapy session on substance use disorders, one of the participants is dominating the conversation. How should the nurse respond? A. Ask the client to leave the group session. B. Pause the session to remind the group of the session's rules. C. Let the client continue to express themselves without interruption. D. Encourage the group to share their thoughts about the monopolization. The correct answer is D. Encourage the group to share their thoughts about the monopolization. D is correct. By inviting the group to reflect on the monopolization, the nurse fosters group cohesion, encourages problem solving, and allows the client to become more self-aware of their behavior in a non-confrontational way. A is incorrect. Asking the client to leave would be a drastic measure and may harm their therapeutic progress. B is incorrect. Stopping the session to review the rules could draw too much attention to the behavior, potentially making the monopolizing client feel targeted. C is incorrect. Allowing the client to continue without intervention would prevent other group members from participating, reducing the effectiveness of the session for the rest of the group. Let's proceed with the next question. This cystic fibrosis diagnosis question has been asked 7 times in the last 5 years, which makes it highly likely to appear on the exam. After receiving a cystic fibrosis diagnosis for their infant, the family is understandably distressed. As their nurse, what should you prioritize? A. Schedule a follow-up appointment with a pediatric pulmonologist. B. Provide emotional support to the family. C. Arrange for financial counseling and assistance. D. Recommend genetic testing for the parents as they plan to have more children soon. The correct answer is B. Provide emotional support to the family. B is correct. After such a profound diagnosis, the family's emotional needs take precedence. Supporting them through this difficult time helps them adjust to their new reality and prepares them to focus on next steps, such as treatment plans or follow-up care. A is incorrect. While scheduling a follow-up with a specialist is important, the family's immediate need is emotional support as they process the life-changing diagnosis. C is incorrect. Financial concerns may arise later, but the immediate priority is addressing the emotional shock and helping the family cope with the initial diagnosis. D is incorrect. Genetic testing is an important consideration for future pregnancies, but it is not the first concern immediately after a cystic fibrosis diagnosis. The family needs emotional support before engaging in long-term planning. Let's move on to the next question. This labor-related question has been asked 6 times in the last 5 years, making it highly probable for the exam. A laboring patient has just received an epidural for pain relief. What should the nurse monitor as a potential adverse effect of the procedure? A. Elevated blood pressure. B. Bladder distension. C. Lowered body temperature. D. Rapid labor progression. The correct answer is B. Bladder distension. B is correct. Bladder distension is a common complication after an epidural because the patient may not feel the urge to void. This could affect labor progression by obstructing the descent of the fetus, so it is essential for the nurse to assess bladder status regularly. A is incorrect. Epidurals more commonly cause hypotension due to vasodilation, so elevated blood pressure is not typically a concern. C is incorrect. Hypothermia is rare with epidurals, and any temperature fluctuations are usually due to other factors. D is incorrect. Epidurals usually slow labor rather than hasten it by relaxing pelvic muscles. Let's continue with the next question. This CPR protocol question has been asked 4 times in the past 5 years, making it moderately likely to appear on the exam. You are caring for a 7-year-old patient who is unresponsive and pulseless. After calling a code blue, what should you do next? A. Start CPR at a 15.2 compression to ventilation ratio for 2 minutes. B. Leave to retrieve an automated external defibrillator, AED, then start CPR at a 30.2 ratio. C. Perform 2 minutes of CPR at a 30.2 compression to ventilation ratio. D. Prepare for IV access and administer epinephrine. The correct answer is C. Perform 2 minutes of CPR at a 30.2 compression to ventilation ratio. C is correct. According to American Heart Association, AHA guidelines, when the nurse is the only rescuer, a 30.2 ratio should be used for CPR on pediatric patients. A is incorrect. A 15.2 ratio is appropriate only when 2 trained rescuers are present for pediatric CPR. B is incorrect. Leaving the patient to retrieve an AED would delay critical life-saving interventions. D is incorrect. Starting CPR immediately is the priority, and IV access is a secondary concern after ensuring circulation is being maintained. Let's move on to the next question. This postpartum care question has been asked 5 times over the past 5 years, making it likely to appear in the exam. A postpartum patient is receiving methylergonavine. What finding would indicate that the medication is having the desired effect? A. Increased blood pressure. B. Decreased postpartum bleeding. C. Reduced uterine tone. D. Increased urinary output. The correct answer is B. Decreased postpartum bleeding. B is correct. Methylergonavine is used to reduce postpartum hemorrhage by increasing uterine contractions, which helps control bleeding. A is incorrect. While methylergonavine can cause elevated blood pressure as a side effect due to its vasoconstrictive properties, this is not its intended therapeutic effect. C is incorrect. Methylergonavine increases uterine tone, which helps reduce bleeding. D is incorrect. Methylergonovine does not directly affect urine output. Let's proceed to the next question. This mental health assessment question has been asked 3 times in the last 5 years, making it less common but still important. A patient is experiencing auditory hallucinations. Which statement by the nurse would be the most appropriate response to this situation? A. What are you hearing? It must be frightening. B. What are the voices saying? Would you like to move to a quieter room? C. What are the voices telling you? That sounds difficult to deal with. D. It must be tough hearing those voices. Can you try to focus on me? The correct answer is A. What are you hearing? It must be frightening. A is correct. This response focuses on the patient's emotional experience without reinforcing the hallucination as real. By acknowledging the emotional impact while remaining neutral about the hallucination's content, the nurse encourages the patient to explore their feelings without validating the hallucination. B is incorrect. Asking, "What are the voices saying?" suggests that the hallucinations are real, which may reinforce the patient's belief in them. C is incorrect. Asking directly about voices again reinforces the hallucination as real. D is incorrect. Asking the patient to refocus on reality without exploring their emotional state may not provide adequate support. Let's move on to the next question. This patient assignment question has been asked 7 times in the last 5 years, making it highly relevant for exam preparation. The charge nurse is making client assignments. Which patient would be most appropriate for a labor and delivery nurse who has been floated to the medical surgical unit? A. Patient on a continuous heparin infusion for a pulmonary embolism. B. Post-operative patient, 8 hours after an appendectomy. C. Patient with a chest tube placed for a pneumothorax. D. Patient admitted for congestive heart failure exacerbation. The correct answer is B. Post-operative patient, 8 hours after an appendectomy. B is correct. Labor and delivery nurses frequently care for post-operative patients after cesarean sections, so their skills will easily transfer to caring for a patient recovering from an appendectomy. A is incorrect. Managing continuous heparin infusions requires knowledge of anticoagulation protocols. C is incorrect. Chest tube management may be outside the scope of practice for a labor and delivery nurse. D is incorrect. Caring for a patient with heart failure requires a deep understanding of cardiovascular monitoring and fluid management. Let's continue to the final question. This preeclampsia management question has been asked 6 times in the last 5 years, making it very relevant for exam preparation. A patient with preeclampsia is receiving a magnesium sulfate infusion. Which assessment should the nurse prioritize to monitor for potential complications? A. Capillary blood glucose. B. Urine-specific gravity. C. Lower extremity range of motion. D. Heart rate and rhythm. The correct answer is D. Heart rate and rhythm. D is correct. Magnesium sulfate can cause cardiac arrhythmias and heart block, so continuous monitoring of heart rate and rhythm is essential to detect early signs of toxicity. A is incorrect. Monitoring capillary blood glucose is relevant for patients receiving insulin or for diabetic patients, but is not related to magnesium sulfate infusions. B is incorrect. Although monitoring urine output is important because decreased output can signal magnesium toxicity, urine-specific gravity is not necessary for assessing magnesium sulfate's effects. C is incorrect. Range of motion of the extremities is less critical than checking deep tendon reflexes, which are more directly related to magnesium toxicity. Let's move to the next question. This elder abuse question has been asked 5 times in the last 5 years, making it moderately likely to appear in the exam. A nurse is speaking to new volunteers at an elderly care club about elder abuse. Which of the following clients is most at risk for elder abuse? A. A 75-year-old man with diabetes. B. A 79-year-old man with cataracts. C. An 87-year-old woman with Parkinson's disease. D. A 64-year-old woman with psoriasis. The correct answer is C. An 87-year-old woman with Parkinson's disease. C is correct. Elder abuse tends to occur more frequently in females of advanced age who have physical or cognitive impairments. The 87-year-old woman with Parkinson's disease is particularly vulnerable due to her age and her condition, which impairs mobility and possibly cognitive function, increasing her dependency on others for care. A is incorrect. While diabetes is a chronic condition, this 75-year-old male does not present the same level of vulnerability as the older woman with Parkinson's. Men are statistically less likely to be victims of elder abuse, and without significant physical or cognitive impairment, his risk is lower. B is incorrect. Cataracts cause visual impairment, but do not result in significant physical or cognitive disability. This 79-year-old man, while older, does not have the same level of dependency that would put him at high risk for abuse. D is incorrect. Psoriasis, a chronic skin condition, does not significantly increase the risk of abuse. Additionally, this woman is only 64 years old, which places her below the age threshold typically associated with higher elder abuse risk. Let's move on to the next question. This hospice care question has been asked 4 times in the last 5 years, making it moderately likely to appear in the exam. A nurse is preparing a staff development seminar on hospice care. Which of the following statements should be included? A. Hospice care focuses on managing symptoms for acute illnesses. B. It is restricted to pain control and symptom relief. C. The goal is to continue curative treatments and therapies. D. Hospice services can be provided in a variety of settings, including homes and inpatient facilities. The correct answer is D. Hospice services can be provided in a variety of settings, including homes and inpatient facilities. D is correct. Hospice care is versatile, providing end-of-life services in multiple environments, such as the patient's home, inpatient hospice facilities, long-term care homes, and even prisons. This adaptability allows hospice to meet patients' needs in various situations, focusing on comfort and quality of life. A is incorrect. Hospice care is not for managing acute illnesses. It is designed for patients who have a terminal diagnosis with a prognosis of 6 months or less. The emphasis is on palliative care rather than managing acute diseases. B is incorrect. While pain management and symptom relief are important components of hospice care, it also includes psychological, social, spiritual, and emotional support. It provides holistic care for both the patient and the family, addressing more than just physical symptoms. C is incorrect. Hospice care does not pursue curative treatments. Once a patient enters hospice care, the focus shifts from curing the illness to providing comfort and managing symptoms, helping the patient live as well as possible during the final stages of life. Let's move on to the next question. This retinal detachment question has been asked 7 times in the last 5 years, making it highly likely to appear in the exam. A nurse is assessing a patient suspected of having retinal detachment. Which symptom would most likely be associated with this condition? A. My vision has become cloudy. B. I am experiencing sharp pain above my eyebrow. C. I am having difficulty with my side vision. D. I am seeing flashes of bright light. The correct answer is D. I am seeing flashes of bright light. D is correct. Seeing flashes of light or floaters is a common symptom of retinal detachment, a serious condition that can lead to permanent vision loss if not treated promptly. These visual disturbances are often described as sudden flashes, indicating the retina is pulling away from the back of the eye. A is incorrect. Cloudy vision is more typical of cataracts, where the lens of the eye becomes opaque, causing blurry or dimmed vision. Cataracts affect the clarity of vision, but do not usually involve sudden flashes or floaters. B is incorrect. Sharp pain above the eyebrow is typically associated with angle closure glaucoma, a condition where the intraocular pressure suddenly increases. Retinal detachment is generally not accompanied by pain. C is incorrect. Peripheral vision loss is more indicative of glaucoma, especially open-angle glaucoma, which progresses slowly and can cause a gradual loss of side vision. Retinal detachment usually presents with more acute visual disturbances, like flashes or floaters. Let's move on to the next question. This epilepsy medication question has been asked 5 times in the last 5 years, making it a frequent topic on exams. The nurse is reviewing laboratory data for a patient with epilepsy taking valproic acid. The patient's VPA level is 40 mcg per ml. What should the nurse do next? A. Assess for possible medication noncompliance. B. Advise the patient to skip the next dose. C. Monitor for signs of valproic acid toxicity. D. Document that the VPA level is within the normal range. The correct answer is A. Assess for possible medication noncompliance. A is correct. Since the patient's VPA level is below the therapeutic range, 50-125 mcg per ml, there is a concern that the patient may not be adhering to their medication regimen. The nurse should assess for potential non-adherence or investigate other reasons for the subtherapeutic level, such as improper dosing or drug interactions. B is incorrect. Skipping a dose would further decrease the drug level, which is already below the therapeutic range. This action could increase the patient's risk of seizures. C is incorrect. VPA toxicity occurs when levels exceed the therapeutic range, above 125 mcg per ml. Since the patient's level is subtherapeutic at 40 mcg per ml, there is no need to assess for toxicity. D is incorrect. A VPA level of 40 mcg per ml is not within the normal therapeutic range. Documenting this as normal would be inaccurate and could delay necessary interventions to adjust the patient's medication. Let's move on to the next question. This catheter insertion question has been asked 6 times in the last 5 years, making it a common and important topic for exams. After inserting an indwelling urinary catheter in a male patient, where should the nurse secure the catheter tubing? A. Inner thigh. B. Upper thigh. C. Lower abdomen. D. Knee. The correct answer is B. Upper thigh. B is correct. For male patients, securing the catheter to the upper thigh helps reduce tension on the urethra and minimizes the risk of injury. The catheter should be positioned in such a way that the tubing has enough slack to prevent pulling or trauma. A is incorrect. Securing the catheter to the inner thigh is more common for female patients due to their shorter urethra. In males, this could cause discomfort or increase the risk of urethral injury. C is incorrect. Although securing the catheter to the lower abdomen is an alternative, the upper thigh is typically preferred for easier access and better positioning. Securing the catheter to the upper abdomen may create excessive tension on the catheter. D is incorrect. Securing the catheter to the knee is inappropriate as it may cause too much tension and pull on the catheter, increasing the risk of urethral trauma and discomfort for the patient.